My name is David Lloyd, and I serve as the Deputy Chief of Programs for Economic Mobility. Strong Family, Strong Futures DC is a direct cash assistance program supporting new and expecting mothers residing in DC wards 5, 7, and 8 during the pivotal first year of their child's life.
My name is Rachel Dennis. I'm a family engagement specialist at Martha's Table in our Economic Mobility Department. So with the Strong Family, Strong Futures program, we have plenty of benefits here at Martha's Table that directly impact and help the mothers, such as we have our markets, which moms can always come and get groceries daily. Monday through Friday is fresh produce, fresh fruits, so that we know that they're eating healthy.
The program provides $10,800 of direct cash assistance over the course of 1 year to 132 mothers. The program is administered by Martha's Table and supported financially by the Office of the Deputy Mayor for Planning and Economic Development.
I'm Kiera Mead. I guess I would say I'm a single mother of 2 beautiful little girls. I'm very grateful for the $10,000. I was able to buy my daughter things that I couldn't buy my first daughter. I was able to provide for my daughter that I couldn't do for the first one. So that's what the benefit was with this program, because I didn't expect to lose my job, but I didn't expect such a blessing.
This program was designed to empower new and expecting mothers with cash so that they have the autonomy and flexibility to make the best choices for themselves and for their child.
We also partner with several organizations for adult education. So we do have public charter schools that we also partner with as well to help our mothers up, and a wealth of sessions and workshops with many organizations over the year to help the mothers financially, with their health, with their goals, to empower them and to also help them with employment and career goals that they have.
Good morning, everyone, and welcome to the 5th Annual Maternal Infant Health Summit. I am Jackie Reyes, the Director of the Mayor's Office on Community Affairs, and I stand here on the shoulders of my previous directors, like Sharon Hines, Lamont Aikens, and Dr. Gibson Hubbard. It is a great honor to be here with you today. We're all here together as women for various walks of life, ethnicities, occupations, neighborhoods to empower each other. It doesn't matter where do you work and where were you from, whether you are from Benning Heights or the waterfront, either from Eastern Market or Mount Pleasant. In all 8 wards, we represent all DC moms. As a single mom, teen mom, and also now working in the government, I understand the struggles that we face, but also the power that we have. As a little girl, I came from El Salvador, and now I'm standing here as the Director on Community Affairs. Thank you, Mayor Bowser, for trusting me. Therefore, it is important for us to take care of ourselves. Our Mayor, Muriel Bowser, ensures us that on her cabinet amplify her commitment to women and diversity. And it speaks volumes of these values. Our offices are led by a host of strong women. At this time, I ask for all of the directors to please stand up in community affairs directors, and you can see the diversity that we have. Now look around you. The women that we represent and advocate for all of us in this room. On behalf of Mayor Muriel Bowser, this amazing event was organized and led by women leadership from the Mayor's Office on Women's and Policies. The initiative director, Jennifer Porter, there's out on maternity leave, but an applause for her, please. Shateria, Natasha, and Elena, thank you for being here today and devoting your time to learn about your health and wellness. And when we leave here today to return to our homes after a long day of work. In activism, remember that to all of us, it's very important roles that we have. In our children's eyes, we are just mom. Thank you so much, and welcome.
Please welcome to the stage at this time, Alexis Squire, Director, Serve DC.
Good morning, everyone. Thank you so much for those warm welcome remarks, Director Reyes. As the presenter mentioned, my name is Alexis Squire, and I have the distinct honor of serving as our city's Chief Service Officer and the Director of the Mayor's Office on Volunteerism and Partnerships, affectionately known as Serve DC. On behalf of our Mayor, Mayor Muriel Bowser, I welcome you to this day that is designed to center the unique and collective experiences of moms and birthing people. What an incredible reason that we are gathered here today. I stand before you as a woman with many hats, a public servant, a community organizer and collaborator, but the role that equips and empowers me to do all of these with the highest level of compassion and accountability is being Levi and Alexander's mom. My 3- and 4-year-old boys may be the reason behind my search for the best under-eye products, but they are also my last thought before I fall asleep and my first that motivates me to get a very, very early start to our mornings with intention and expectation. Ensuring that their lives are centered, are protected, are well-resourced, are always on my to-do list. And as I look around this room, I know that I am not alone. This is why our visionary mayor set an unprecedented and bold commitment of creating collective spaces and investments 5 years ago to ensure that moms across our city, from wards 1 through 8, have access to the tools and resources to ensure that our most precious babies are able to thrive by 5 and beyond. She also recognized that as a government, we can't do it alone. And lucky for us, because of our DC values, we don't have to. We have partners across all sectors, including the business and philanthropic community and our community-based organizations, who are inspired by our mayor's commitment and leadership and lean in year after year to ensure that our residents get the true benefit of our collaboration and shared solutions. And so, on behalf of Mayor Bowser, which you will hear from in a few moments, I would like to publicly thank all of our partners. Can you please stand if you're partnering with us here today? You may see their logos displayed, but know that there's so much behind those logos. They not only make today possible through their generous support and thought leadership and innovative investments and interventions, but they make all days possible for moms and birthing people across our city. And most especially for babies like my Levi and Alexander, and thousands of others who are counting on us and our ability to work together, to dream together, so that they get the fair shot that they deserve. Thank you, and please enjoy this incredible day.
Hello, and thank you for being here today. I'm Dr. Laura Hendricks Jackson, Vice President of Patient Care Services and Chief Nursing Officer at Sibley Memorial Hospital, part of Johns Hopkins Medicine in the National Capital Region. As Sibley's Chief Nurse and a mother myself, I'm deeply honored to welcome you today to Mayor Bowser's 5th Annual Maternal and Infant Health Summit, an event that connects women, babies, and families with the resources they need to strive. I am thankful that Mayor Bowser's Maternal and Infant Health Summit gives us all an opportunity to reflect on the district's impressive investments in the health of women, babies, and families. And it allows for us to collaborate and explore strategies to improve maternal health and address racial disparities in health outcomes. Having a baby is one of the most memorable times in the life of a family, and all expecting parents deserve access to high-quality, compassionate care. No baby should be at higher risk of birth complications. No mother should be at higher risk of death during childbirth, simply because of where she lives or her skin color. We know that it is not always the case, so at Sibley Memorial Hospital and Johns Hopkins Medicine, we are focused on the holistic needs of mothers. Through our maternal fetal medicine program, we work together with our patients to address the many factors that contribute to maternal and infant health. And our experienced labor and delivery team provides high-quality, compassionate care throughout the childbirth experience and beyond. Ensuring that all moms and babies get the care that they need and deserve is a key priority for us. We want to make sure that Sibley is more accessible to women in all wards of the district. We are committed to doing our part to help improve health outcomes, and we strive to work together with individuals across DC, many of whom are here today, to ensure that our mothers and families have access to the support and services they need. I look forward to working together with you on strategies to address racial disparities and improve health outcomes for women and families in our community. Thank you for allowing me the opportunity to speak with you today.
Now, let us receive to the stage at this time Bill Deal, Market Head of Sales at Aetna Public Sector.
Good morning. I'm honored to be here today with you at the 5th Annual Mayor Muriel Bowser's National Maternal and Infant Health Summit. Thank you, Mayor Bowser, for your service and commitment to the District of Columbia and its residents, for being a champion of women's health, and for welcoming Aetna as a participating sponsor and presenter. My name is Bill Deal, and I lead the local public sector segment for Aetna. Aetna is committed to raising awareness around health risks women face and providing collective resources to connect families with the support they need to improve health outcomes. As a leader in healthcare, not only have we expanded our services and created specific programs around women's health, but also we're focused on increasing access to quality health services through our health benefits programs and community relationships. Our investments in the District of Columbia also address a range of health equity issues, including affordable housing and workforce initiative investments. This morning, I have the distinct honor of introducing our leader, Muriel Bowser. Mayor Bowser is committed to ensuring every Washingtonian gets a fair shot at a growing, prosperous Washington, D.C. Her administration focuses on making the district's success more inclusive, advancing the district's values, and building safer, stronger, healthier neighborhoods across the district's 8 wards. Washington, D.C. is a unique area in our political system. The mayor, the chief executive, functions as a governor, a county executive, and a mayor. Like governors, Mayor Bowser runs Medicaid, issues driver's license, and has tax authority. Like county executives, Mayor Bowser runs the local jail. And unlike most mayors, also oversees the public school system. And even with all of those responsibilities, she is a mother to an amazing daughter. She is our mayor and a leader who cares about the most vulnerable, our mothers and babies. We applaud you, Mayor Bowser, for your efforts to spotlight this significant issue and provide resources and results for those who need them most. So please join me in welcoming the Mayor of the District of Columbia, the Honorable Muriel Bowser.
Good morning, everybody. I want to thank you, Bill, for that very kind introduction, and I want to thank everyone who has taken time out of your days and your lives to help us strategize and focus on a very important issue, not only to DC women and families, but to our nation's women and families. I want to welcome and thank all of our speakers who are distinguished, awesome experts in this space who are going to bring so much to our conversation. And I want to especially acknowledge the members of Congress who are here. Please give them a big round of applause. And I want to thank all of our friends in the Washington Convention Center and my team, of course, in the Office of Women's Policy and Initiatives, who focus on maternal and infant health all year, and who also focus on making sure all of the agencies of our government are supporting women and families, whether it's in our budgets, our initiatives, and our programs and services. Today, we are really here to talk about how families can have a strong start. And we know that when we support families before pregnancy, during pregnancy, and after pregnancy, we have the best opportunity to have healthy outcomes for our babies. We know that this work begins long before pregnancy, and it continues long after a child is born. You already saw the video about our Strong Families, Strong Futures program. We're very proud to partner with Martha's Table in that effort, so thank you, Martha's Table, for your partnership and great work. You heard how simple the program is. It's very simple. We know that people have needs, and we supply them with the cash need that they have. And in doing so, we trust women and families to make decisions about how to use that money. We trust them to know how it's going to best support their kids. Trusting women to make the best decisions about their health shouldn't be a novel concept. And trusting pregnant women to know when they feel right and when they don't, and to make sure that the medical system listens to them, and trust them when they say that they need more help or something's wrong during and after labor. Trusting families is part of what will help make our outcomes better. And trusting experts when they say that it's just as important to access health care, it is also important to have safe housing, clean water, and healthy neighborhoods. We know that this is the idea behind Strong Families, simply giving families $900 in unrestricted dollars to use for their families. It is also why last month we used part of our American Rescue dollars to provide 15,000 families who are part of our TANF program an additional $1,000 payment for back to school. So we know that economic mobility is a huge part of how we'll have healthy outcomes for our babies and our young people. And you will hear us talking about all kinds of ways, some pilot programs that we are instituting, and some things that we have made a part of our annual budget commitment. And part of that is making sure that more people have access to home ownership. You've heard me talk about in many times that I made a decision in my late 20s, which wasn't that long ago. But I was part of a first-time home buyer program that changed my life. I didn't make a lot of money at the time, and I had some savings, but not a lot. But I had the yearning to be in my city, to be in a great neighborhood, and to start building equity in my own life. And I got in a first-time home buyers program, and I bought a little house in a good neighborhood. I worked my tail off with my neighbors to make it a great neighborhood. And having that house and building equity in that home has allowed me to make a lot of bets on myself. And so that's why we talk about how important it is to invest in families so that they can dream big for themselves and for their own families. So in fact, that's why this pilot is so important to what we have to do. We know, however, that there are a lot of forces that contribute to the birth outcomes that are not as good for Black women as they are for our sisters across the nation. So we know the forces against us include a system of racism that is hundreds of years old, sexism that women of color face both, and they have impacts on how we interact with our medical system, how the medical system interacts with us, the stresses that have come along with both. And we know that we have to use a whole of government approach to deal with both. So in DC, we are working very hard to unravel those systems and to build new ones. We are building a healthcare workforce that includes more people from the communities that we're asking the system to serve. So just as we built the most robust free pre-K program in the nation, we are also prioritizing access to affordable, high-quality childcare for infants and toddlers. So this work is hard. It's going to be a long-term commitment because we know we need to attract more people to provide health care in Washington, D.C. I know this is music to the ears of all the people in the hospital community, because they're spending every day, like we are, trying to figure out how we can train and attract more nurses in Washington, D.C. Anybody out there interested in nursing? Congresswoman, we have to get some nurse. As a daughter of a nurse who is 84 years old and still nursing in some aspects, we should be attracting and training more of our young people to be nurses in our city, to get a good paying job, and to make sure that our healthcare system is prepared. And it also includes other healthcare opportunities. Even I was talking to our fire chief. We want to attract and train more EMTs and paramedics in our city for good paying jobs. And we want to make sure that more people who were born and raised here, like me and like many of you, can afford to live and stay here. And that is why in this budget, we have made historic investments in affordable housing, in training DC residents, in helping small and local businesses be able to build and grow their businesses right in DC as part of our $40 million legacy package. So in the 5 years that I've hosted this summit, the topics, you have told us what you want to talk about. And the topics have grown and evolved. And this year we will have a real focus on talking about how the economics and economic mobility affects our ability to have healthy families in Washington, D.C. So this is one thing I also want to emphasize, that as we grow the topics and as our Congresswomen have been successful in moving national packages to focus on women's health, we can't ever stop speaking up. We can't ever stop talking about this issue to make sure the voices of women are heard loud and clear. In a country as prosperous as ours, you should not have to risk your life to have a baby.
Please welcome to the stage at this time our moderator, Nicole Austin Hillary. Congressional Black Caucus Foundation. Please welcome to the stage our panelists for the Panel 1, Economic Equity. Our moderator, Nicole Austin Hillary, the Honorable Mayor Muriel Bowser, Dr. Ndidi Amuta Anukaga, Representative Chantel Brown, Representative Lauren Underwood. Let's receive them at this time.
Good morning, everyone. It is such a pleasure to be here with you all. Mayor Bowser, thank you for having the foresight and the wisdom to put together this amazing, amazing discussion today.
Well, thank you.
These are critically important issues. I am Nicole Austin Hillary. I'm the president and CEO of the Congressional Black Caucus Foundation, and I'm pleased to be here with you this morning to moderate this panel with this illustrious group of smart, talented, dedicated, I'm going to call them warriors. Because warriors, yes, you can applaud for that. Because when we are talking about issues of maternal and infant health, these are critical issues. These are life-changing issues. And this is serious business that we're about today. So we're going to go ahead and get into our discussion. Mayor, I'm going to start with you. This was your brainchild to have this event. This is the 5th year. Tell us, when you look back, let's just look back to last year, what are some of the changes and progress that you think has been made since we held this summit last year?
Well, I think we've been able to make tremendous progress. And when I look back over the 5 years, in fact, I just see the topic is top of mind for a lot of people, not just women. They're top of mind for policymakers, they're top of mind for community members, for executives in our healthcare system. So that we have raised the level of conversation. We have been, I think, able to add voice to the national conversation when our lawmakers are considering bills. And that has been very important. We've also been able to create more partnerships and forge partnership, for example, with the March of Dimes, but also forge more partnerships with our local provider community, which has been centered in our conversations about what women need and what families need and how we can get them into our services. Now, one thing that troubles me about programs, great programs that we craft and we come up with and we think a lot about, and then people don't participate in them. And so we're always trying to make sure that we're connecting people and making it easier for people to participate. And that's why the Strong Families, Strong Futures was such an important advance for us. Because in the discussion of what people need, giving cash payments has been controversial at times, but we have been able to target our investments where we believe they're going to have the biggest impact on the first year of young people's lives, and what's more important than that. So when I look back on last year, we knew that we would have these partnerships in place, but we've actually had experience with it, which gave me a lot of confidence to say I can use some of these very important American Rescue dollars to do something similar for TANF families who were getting their kids ready for school.
That's wonderful, thank you. Let's applaud that. That is a lot of progress. And Mayor, I'm excited that you talked about partnerships. Because we really have an example of partnerships right here on the stage with us today. It is so vitally important when we have both local and federal leaders working together. So I'm going to turn to one of our members of Congress, whom we're so happy to have with us here today. I'm going to start with you, Congresswoman Underwood. What is the Black Maternal Health Caucus focused on in the last few months of the 117th Congress? I know that is an effort that is near and dear to your heart. It's very much a focus of your work. So tell us a little bit about what the caucus is doing.
Thank you so much. I'm so delighted to be here in the District of Columbia. It has been a real honor to be able to work with Mayor Bowser. with the Black Maternal Health Caucus, which is one of the largest bipartisan caucuses in the United States Congress, exclusively focused on ending our nation's maternal health crisis. I share Mayor Bowser's point of view that in 2022, we should not have moms dying as a result of childbirth in this country. We know what to do in order to save moms' lives, and we need to be courageous enough to make the policy choices, to make those policy changes and investments to save lives. So I introduced a large bill. It's called the Black Maternal Health Momnibus Act. There's a legislative word called an omnibus, and it's for moms, so that's where the name came from. It's 12 bills to address every clinical and non-clinical factor that's contributing to maternal mortality in this country. One of our bills, the Protecting Moms Who Served Act to help our veteran moms, was signed into law by President Biden in November of 2021. Another has passed the House already with unanimous bipartisan support. It's called the Maternal Vaccination Act. And then 80% of the rest was in a big bill called the Build Back Better Act at the end of 2021. We are on a mission to find a legislative vehicle to get the rest of the Momnibus signed into law by the end of this calendar year. But to do it, we will need your help. Congresswoman Brown and I are focused. We're doing the work. We're talking to our colleagues. We have great Senate partners. Senator Cory Booker is our lead sponsor in the Senate, but there's some bipartisan aspects of it over there. And so listen, I know the district, we're working on your representation. Okay, we have not forgotten that we need to get this done. But in the meantime, y'all are here, your voices matter, and they resonate in the halls of Capitol Hill. So I would invite you to join us in the advocacy to get the Momnibus signed into law by the end of 2022.
Thank you. Thank you. And Congresswoman Underwood, you just stole one of my questions, because I was going to ask you now, what does everyone else need to do? But you just gave everyone
action items.
Orders.
Let's go.
You all have them, right? You're taking notes. Congresswoman Brown, I want to talk about data. We all know that numbers and data are vitally important, particularly for those of you who are lawmakers. In your home state of Ohio, the mortality rate for Black infants is unfortunately 3 times as high as the mortality rate for white infants. Further, we know that Black women are 3 to 4 times more likely to die from childbirth and pregnancy-related causes than white women. And everyone needs to know that that is regardless of class, educational background. It's a race issue. And Mayor, we're going to have real conversation today, right? Because we know that racial justice issues play a role in pretty much everything that we have to focus on and all the systems that we have to deal with. So given that, Congresswoman Brown, what steps does the federal government need to take in order to remove discrimination and bias from maternal health care as we are facing it right now?
Well, thank you for that question, and I also want to associate myself with the Mayor's comments and my colleagues' comments. And thank you, Mayor, for putting this together. It is such a tremendous honor and pleasure to be here. For the people that don't know me, my career in politics started in local government. And prior to coming to Congress, I led the initiative to declare racism a public health crisis. That work was started because of the disparities in our infant and maternal mortality, specifically in Cleveland, where we have world-class hospitals, ranked #1 in the world for so many things, but we had 3rd world infant mortality rates. And to your point, it did not make sense to me because this was not an economic issue, it was not a social class issue, but what we learned in the research is that there was systemic, institutional, and structural racism that created toxic stress in women that has been passed down since slavery. One of the analogies that I have picked up from my YouTube university was a young lady who spoke so powerfully about racism and how it has impacted our society. And she used the Monopoly game as an analogy. And she spoke about if you were playing a game of Monopoly and you were told that you did not have the opportunity to play for 400 rounds. And for each of those turns, you had to work for someone else. How would that impact your life? Then after that, you were given the opportunity to play. So now you have to play catch up. But you don't have anything to catch up with. So, but despite that, you're able to do it over the next 50 rounds. You start to make advances. Then someone comes and burns your game, like they did in Rosewood, in Tulsa. That is the story of Black America. So now we're again starting from scratch. And then you are told again, you still have an opportunity to play and catch up. But you can't. And the only way to level the playing field is if I give you some of what I have earned over those, or what I've acquired over those rounds that we were playing. So now there becomes this mental anxiety, because I'm telling you, you don't have what you have because you earned it. You have what you have because I gave it to you. It creates a toxic stress that is passed down from generations through slavery, that has created this debilitating effect for women to be able to carry their babies to full term. So how do we deal with that? Well, we deal with it by things that you have already talked about. Putting financial resources into hands, creating programs around equity and criminal justice and education and transportation, where all of these things that have had an impact on our society have created such disparities in the African American community. So it's not just about financial resources, it is about clean drinking water, removing redlining so that we have quality homes, making sure that we have green space so that we can live an enjoyable life in our community. These are the things that we have to be very conscious and aware of, and make the investments and provide the tools so that women that look like me and the ladies on this panel can have a better quality of life and be able to carry their babies to full term. So declaring racism as a public health crisis was not just words on paper. For me, it was about making measurable, tangible results. So starting at a place where we include statistical data about the disparities and seeing where we can go from there.
Thank you, Congresswoman. And I want to underscore something about your comments, which is that it's important that we know that you have to connect the dots. None of these issues are issues that we deal with in silos, correct? You just discussed, Congresswoman, that this is related to clean water, it's related to our schools, it's related to clean and adequate housing. And I will tell you, just this morning on National Public Radio, for those of you who, like me, are NPR junkies, they had a story that talked about the connection between the water crisis in Flint, Michigan, and how that had a disparate impact on Black and brown and low-income communities, and changes to our voting and redistricting laws in the country. And you know, you all, I'm a lawyer, and I've worked on many issues over the course of my career. I did not realize that connection myself. So it is so important what Congresswoman Brown just pointed out. We have to connect the dots on so many of these issues. And an important part of connecting the dots is having medical expertise like we have on the stage with us today. And Dr. Anukoga, I'm so proud to have you with us today.
Thank you. Good morning.
Good morning. Let me ask you this. We all have been living through and are continuing to live through a pandemic. The COVID crisis brought to bear so many of the disparities that people in Black and brown communities always knew existed. But for some reason, the rest of the country and perhaps the rest of the world did not know these disparities existed. Can you talk to us a little bit, as a researcher, about how COVID-19 has affected our communities and changing health outcomes specifically for expectant mothers?
Good morning, everyone. Thank you for the opportunity. Thank you, Mayor Bowser, and I'm so pleased. It's such an honor to be here. So the COVID-19 pandemic, like you said, has exacerbated things that we already knew through our lived experiences as Black and American. Racism is the underpinning of all of this, and we saw it from the beginning of the pandemic, even how things were rolled out. Information was translated, what languages, who got the vaccines, how often the clinics were staffed. And so the pandemic just exacerbated what we already knew. How did this play out in pregnancy and maternal health? So during the pandemic, at the height of it, Black and brown birthing people who tested positive had their babies physically removed from the room, right, for the safety of the baby. And I think at the end of the day, a lot of the social support that is so critical in pregnancy, particularly for our communities, was stripped away. I mean, the group prenatal care, the centering pregnancy model, which you're getting women together, going through the process based on your gestational age, having your birthing people in the room with you. I had a child, my first son was April 2019, right before the pandemic. My second son was October 2021, towards later pandemic, even though we're still in a pandemic. And my husband, my partner, was able to come to all prenatal visits. That's incredibly important. People that delivered in the middle, 2020, 2021, they didn't have that. So your person is not able to be in the room. They were restricting doulas, right? We saw that things were happening in different hospitals. In Massachusetts, where I bring you greetings from, we created the Massachusetts COVID-19 Maternal Equity Coalition because we were hearing stories from Black and brown birthing people saying, this is not happening in this other hospital. They're able to have support people. I'm not able to have support people, lactation consultants, doulas in the postpartum space, all of these resources that are critical to combating what we know are maternal health inequities were really reduced and frankly eliminated, particularly in communities of color. So that's how the pandemic really, really had a bad impact on us. We also saw an increase in maternal death during the pandemic. The rates increased. The latest data that we have available from 2020 shows a sharp increase in Black communities. That is problematic. That was highlighted by the pandemic.
You know, thank you so much for underscoring that. And I have a question for you. Do you think that we're seeing a surge in responsiveness from communities and from leaders like Mayor Bowser? Clearly we're seeing responsiveness here, but what are we seeing around the rest of the country? Are we seeing real tangible changes?
Yeah, I think we're seeing it in waves and pockets. We have these amazing congresswomen here fighting in Illinois, fighting in Ohio, fighting in pockets across the country. My home state of New Jersey, the First Lady has taken this on as one of her initiatives. The work that I'm doing in Massachusetts in partnership with Congresswoman Ayanna Presley, some of our state and elected officials, there's pockets of change. I do think there's large parts of the country where, frankly, we have not been able to make the traction. I hear far too often, I get it in my DMs and my LinkedIn's around people experiencing traumatic birthing experiences, women who are really disregarded and dismissed in the healthcare system. So we have not made the collective push that I would like to see us happen, but this is very encouraging to me. The work that we're doing in my Center for Black Maternal Health and Reproductive Justice, I just started it at Tufts University where I'm a professor. That is the beginning of the type of change we need to see. These academic community partnerships, centering the role of communities, leading it with Black and brown faces. If you go on our website, my staff looks like the communities that we're serving. That is how you start to make some of these inroads in partnership with policy, in partnership with leadership, in partnership with education, housing, transportation. It's not a single dimensional problem. Like you were talking about, people are not making the connection between housing and water and birth outcomes, economic stability and birth outcomes, stress. Congressman Brown talked about the impact of stress in our bodies. All of these physiologic things are played out because of what we have access to. This is the social determinants of health. So until we start to look at it from a holistic perspective, you're bringing in transportation, you're bringing in Medicaid, you're bringing in all these other entities, housing, education. We are not going to make the dent that we need to make to save the lives and allow our beautiful sisters to carry to term. I mean, this conversation is so multifaceted and the need is so critical. And until we start making those connections and frankly stop working in silos, sharing resources, sharing ideas, sharing funding people that are doing the work, we're not going to move this needle.
I'm about to drop my microphone, but I won't. I won't.
Thank you.
And congratulations on your work at Tufts.
Thank you so much.
And you know what I'm loving, and you all, we did not prepare notes together.
No.
We are all talking about our individual work here, but I love that we are showing the connections. And Mayor, I want to come back to you because one of the things that you have focused on is the importance of connecting the dots with respect to your entire administration. You haven't said, well, this is just an issue for my health division. You have taken a whole government approach to dealing with this issue. Tell us why that's important.
That is so vital because, and it happens a lot in governments. I'm sure you can understand how if it gets called a women's issue, then it's our women's policy office. Or if it's just about health, then we tend to only talk about doctors and, no offense, doctors and hospitals. And we don't focus on how housing and transportation. And one thing that we haven't talked about is education. Because one, I think, big impact of the pandemic as well is that our families were disconnected from school. And in our city, we put a lot of adults who can help families in the schoolhouse. And when the schoolhouse was closed for a year, people weren't connected to a lot of the resources, including pregnant women, that could have really helped them at a time when they really needed it. So we've been very focused on making sure that our government is open, that those years, almost 2 years, where services weren't always in person, weren't as intensive as they were before the pandemic, are getting back on track. But we also learned in the pandemic that some things happening virtually were better. We did see people, depending on what the service was, being better able to keep appointments. And to see their physicians or providers without the hurdle of transportation. So there are things that we learned in the pandemic that worked, that we want to double down on, especially in the telehealth space. And so we're going to continue to do that. And the other thing that I wanted to add about how the government can support this space that sometimes people don't think about, but we're home to Howard University here in Washington, D.C., and we're very proud of that. But more than that, the Howard University Medical School that trains a huge number of Black physicians for our country. And so we have been very focused on, and the doctor talked about academic partnerships, how we could partner with Howard University in this space as well to create centers of excellence that focus on maternal and infant health. But they also have a public safety focus, they have a dental focus, and all are aimed at making Black people in our city healthier and in our nation because they're training so many Black doctors. But we know that that is a role that local government can play and the federal government can play, making sure that we're investing in training people who are going to become our future health providers.
Wonderful. Thank you, Mayor. And I really hope that other mayors are listening to you and replicating this, because really what you're doing is creating a template for change. Yes. And I also want to thank you, Mayor. I am a proud graduate of the Howard University School of Law, the only law school in the country to attend. And I always try to promote that, but you did it for me, so thank you. Thank you. I want to go back to your point about education, because when we talk about these issues, it's not only important to talk about how the educational community and access has been impacted, but also how important it is to educate the community about these issues. You know, one of the things that we do at the Congressional Black Caucus Foundation that we're very proud of is we have a leadership institute. And it's one of the hallmarks of the foundation where we ensure that interns and fellows have opportunities to learn about policy in Washington. And our fellows in particular do research on these critical issues, and we have fellows. In fact, I have 2 of them in the room. They're somewhere here, and we love them. They do wonderful work, and they are experts. They are both doctors, and they are doing work on these very issues. And Congresswoman Congresswoman Underwood, is a proud example. She is a former intern with the Leadership Institute at the Congressional Black Caucus Foundation. So we are obviously so very proud of her and her accomplishments. But I want to come back to you, Congresswoman Underwood. You are also a registered nurse. So as a registered nurse and as someone who represents the great state of Illinois, can you talk to us about what the federal government can learn from nurses and states across the country to help address this issue? And we heard the mayor say her mother is a nurse. What can you all teach us and what should we be focusing on?
Yes, I am a very proud registered nurse. I'm a public health nurse, and I use my nursing skills every day. Thank you. Every day in this job. One of the things that we learned very early on in nursing school is to do an assessment first. And believe it or not, that is so rare on Capitol Hill. So many of my colleagues have their favorite solution that they skip over the part of learning about the problem. And when they embrace that favorite solution, it doesn't matter what the data says. It doesn't matter if it will actually work. They're all in. I have a different approach. I have a data-driven, evidence-based approach to legislating and problem solving, but we have to do that full assessment. And so earlier in the conversation, we mentioned the data, right? Black women are 3 to 4 times more likely to die. For every death, there are 70 near misses. That is unacceptable. So we have this dual crisis in this country of maternal mortality and severe morbidity. And because we understand the nature of the problem after doing that assessment, then we can embrace evidence-based solutions to save lives. This is not theoretical. This is not hypothetical. This will work. We know how much it's going to cost, $3 billion over 10 years, and we end the disparity in this country. The United States no longer leads the industrialized world in maternal deaths. And guess what? It's not just helping Black moms. It helps all of our moms. And so I think, thank you. I think we need more nurses in Congress, obviously. Our colleague, Cori Bush, couldn't make it. She's one of our other nurses, and we have one more, the great chairwoman, Eddie Bernice Johnson. We are a trio of Black women. We are nurses. We are proud, and we're doing the work. But we need to be in these spaces. We need to be in every state legislature. We need to be running major cities. We need to be in the governor's mansions. We need to be in these places embracing these data-driven solutions. You didn't ask me about this, but I would be remiss if I did not mention the vaccine. The doctor talked about what happened during COVID and why we saw so many Black moms dying. Part of the problem is that for so long, the docs and the advisors did not recommend that pregnant people take the vaccine. They were not included in the vaccine trials. It is essential. We just had a new version of the vaccine roll out. It works. We need to be getting our expectant moms, our postpartum moms, we need to be getting vaccinated. We don't have to continue to die as a result of COVID-19. And any conversation that we have about saving moms' lives in this environment, we can't skip over that. So I'm sorry to make that little public health interjection, but we have to do it.
Absolutely. Thank you, Congresswoman Underwood. And you see, I don't stick to scripts, so that's fine. This is a conversation, okay? We're having a real honest conversation about what needs to be said.
So can I just jump in? Because usually it's me telling everybody to get vaccinated, but you heard it from the Congresswoman. Get your vaccination.
Thank you.
That's right.
Now, Congresswoman Brown, a little birdie told me that we might lose you shortly, that you might have a hard stop. So I want to make sure that we hear more of your wisdom before you have to go on to your next important business. Talk to us a little bit more about what can be going on the state level and how we can ensure that we are growing people's interest and focus on these issues. Because one of the questions people ask me all the time is, what can I do from the perch where I sit? And I always like to let people know there's so much you can do. You don't have to be a member of Congress. You don't have to be a mayor. You don't have to be a doctor. There are things that you can do. Talk to us about the kinds of tools that people should be employing right in their own backyards.
Thank you for that. So it's, to me, things might sound incredibly simple, but the golden rule, first and foremost, treat people like you want to be treated. When we go into the hospitals, and as Black women, there is no mistaking that our tolerance for pain is deemed higher than most. And so we have to remove some of these implicit biases from our doctors and nurses and people who are giving us medical health care, because that is a big issue. There's an organization in Cleveland, Risk LD, that really works hard to remove the implicit bias by focusing on what Congresswoman Underwood talked about, the data, the real data, looking at your vital statistics and not just going off of what you or the doctor may be perceiving as a tolerant level of pain, implementing those things. But for the everyday folks who are looking for something to do, being more aware about these issues and being able to have uncomfortable conversations. I say this often, as a Black woman, I'm comfortable being in uncomfortable spaces. It happens to us frequently. I was just in a room yesterday with the Ohio's Farmers Bureau. I was the only woman in the room that was Black. And I was like, okay, but I'm comfortable in that space. And so we have to be comfortable having some of these uncomfortable conversations. And if you're uncomfortable, then you should be asking yourself why. Why am I uncomfortable talking about these difficult issues? Because we have to get rid of these barriers, these statistics, these stereotypes, these things that are causing the implicit bias that are costing people that look like me their lives. And that's what we have to think about, the factor of how important it is, because you are risking people's lives. How important is it to take care of your neighbor? How important is it to make sure that we are promoting healthy lifestyles and making sure that people are getting what they need both mentally, physically, emotionally, and spiritually. The thing that I most appreciate about this conversation is it is a holistic approach. It's the medical, it's the policy, it's the leadership, it is the education. It is bringing all these components together to make sure that we are working holistically to find solutions. We've been working in silos too long. We have to stop doing that. It is not helpful to work in silos. We have to share the information, and we have to get to know each other better, and we have to also extend each other some grace. One of the things that when we start to talk about racism, our Caucasian counterparts often get defensive, right? But if we were to diagnose someone with cancer, you don't get mad at the doctor for diagnosing you with cancer. You try to figure out what it is we can do to eradicate the cancer. We do everything that we can to figure out how we can get rid of that cancer. Well, we need to be approaching these issues with that same vigor and vigilance to make sure how we get rid of the systemic, institutional, and structural racist barriers that have made this a conversation for too long. Putting things into action, creating measurable metrics around education, around access to affordable housing, around investing in transportation, around criminal justice reform, around investing in mental health. These are the things that we need to be doing collectively and collaboratively to make sure that we are no longer having conversations about this and moving on to issues. Because the thing that is most disturbing, and I think all of my panelists would agree, more than half of the deaths are preventable. Lauren, our Congresswoman Underwood said it, we know what to do, we just have to start doing it.
Thank you, thank you. Those are marching orders for all of us. Those are marching orders. Dr. Anu Koga, I'd like to ask you this. When we talk about economics, and we've talked, a lot of people are focused on what happens after the fact. We know about so many of the issues and how economics impacts mothers and maternal health issues once children are born. But talk to us about the role economics plays as we are leading up to giving birth and people expanding their families. That's something that people aren't really focused on. Help us to understand that connection too as we are talking about the inextricable links between all of these issues.
Great, thank you so much. So oftentimes when I'm asked to speak about things like this, and I just want to clarify, I have a PhD in maternal child health. I'm not a OBGYN. Shout out to my OBs and MFMs. They're great colleagues, but I am in the public health space through and through. You know, one of the things that led me to actually get a PhD in maternal child health and focus on research was thinking about inequities. I grew up in Trenton, New Jersey, the capital of the state, very underserved community. That's actually a maternity care desert now. And the hospital I was born in, my siblings were born in, no longer have OB units. And so you remove this economic base from a major city. Trenton actually never recovered from the riots of the 60s. It's still very heavily underinvested in. And then you wonder why people have adverse birth outcomes, right? And so I was led to this work really from the loss of a childhood friend, Waikia Moore. She was 15, I was 16, and she died from complications of lupus. That's what got me in pregnancy after she delivered. That's what got me thinking about economics. She delivered in a local hospital, and we know that black women that deliver in majority black communities and neighborhoods and hospitals have lower investment. They're less likely to have access to the resources. They're less likely to have fully staffed units to give them the care that they need. So she delivered in a very rundown mill hospital. We were teenagers at the time. You're not thinking about the impact of economics. Maybe she had been at a better resourced hospital. She would still be here now to raise her daughter, who just graduated from law school, by the way. And so I think about the impact of economics. I think about the impact of economics daily because I see it play out. If a community does not have economic stability, the opportunities are going to be decreased. The likelihood of upward mobility is going to be harder. Graduating from Trenton Public Schools K through 12, my mom still lives there. That's still home for me. When I come over, I see the Trenton Makes, the World Takes Bridge. I still get excited because that's home. That's home base for me. And I come back and I see, economic disinvestment. I see friends that I grew up with and they're struggling and they're having complications in their pregnancy. One of my girlfriends, she had a placental abruption, a very high-risk complication of pregnancy. And there's no place in the city of Trenton she can go get the level of care that she needs. That is racism. So she had to take an ambulance, which she doesn't have the money to pay for, to a hospital in a more affluent part of the state to get the care that she needed. This conversation about economics is critical. I love what you're doing here in the district with the cash assistance. That is amazing, because when you give women the resources to make the decisions that they need to make, we are building capacity. We're building opportunities. When you remove economic investment in the schools, you remove economic stability in poor housing. We have older housing that's not quality, more likely to have lead. Children that are born with lead poisoning or exposed to lead have lower cognitive function and are more likely to need specialized services, which plays out in how they're tracked in education, which plays out over the course of their life and their financial stability and financial opportunities. So these connections are critical. The role of economics. When you invest in a community, you invest in women, you invest in everybody. That if we don't get that part, we're not going to make this thing go away. I just feel so strongly about the role of economics, tying it back to opportunities, tying it back to housing, tying it back to assistance. Give women the money to do what they need to do. That's it. And so if we create these bases, and also workforce development, it burns my grits when I see these. I know I'm from Jersey, but I like that term. It burns my grits when I see these. When I see these, requirements for jobs. You have to have 5 years of post-baccalaureate. You have to have a college degree. No, you don't. That does not speak to your expertise and capacity. What you're doing is leaving out a large portion of the workforce who cannot get those types of jobs. So, for me, I think we need to revamp the system. I'm actually in my Center for Black Maternal Health. We're working with the local community college in Boston to create a certificate program. We're going to take community health workers, we're going to take doulas, we're going to take midwives and train them in this maternal health and equity space. And then they're going to be able to get higher paying jobs because they have the certificate. We're going to be launching that next year. That just, God gives you these ideas. We had a relationship with the local community college, and this is going to be part of the workforce. The workforce is going to look different. I love Mayor Bowser. She was up here recruiting for nurses. Anybody want to be a nurse? You better come talk to her, because she was talking about recruiting for nurses. Our workforce does not look like the way it needs to look. Right? We need to train people. I'm talking middle school, high school, put them in spaces where these things feel attainable. When I give talks, particularly back home in Trenton, people are like, oh, did you grow up here? Yes, girl. I used to sit in that desk right there. My name is carved under the, people, because people like me don't make it out. To get a high school, bachelor's, master's, PhD, I'm legit a unicorn and still have some swag, I would think. You feel me? Like, I'm not so far gone that I don't have swag. That is hard to come by, but we have to make those models of success more attainable for our communities. That is the key.
Can I piggyback off of that?
Yes, please.
Because one of the things that Mayor Bowser and Dr. Dede highlighted was the investments into making sure that women get the resources that they need. And I want to thank Congresswoman Underwood, because this was before I arrived, was via the American Rescue Plan. And that has been extended 12 months, but because we have stalled in the Senate, stalled Medicaid, stalled in the Senate, the Build Back Better, the child tax credit is no longer available, which lifted 50% of women and families out of poverty. So it is important that you have the right policy makers in positions to be able to make these decisions so that we can get the resources that we need. So again, kudos to everyone on this stage. I am just a person that is soaking up the good ideas and hard work that has already been laid the foundation for me to be able to come in and run a little bit further. So thank you, ladies, for everything that you've done.
Thank you.
Thank you. Thank you. Look, this conversation could go on for hours, am I right? We could be up here for a long time, but I've got to let everyone go. But let me do this before we end. And let me also underscore that not only was the mayor pushing for nurses, so too was Congresswoman Underwood, okay? so we're working together. But Congresswoman Underwood, I'm going to give you and then the mayor the final words. And this is what I want to ask you. We've talked a lot about the various stakeholders who are already around the table. Who is not around the table that needs to be, let's call it out, and let's say what it is we need those other stakeholders to do. And Mayor, I have the same question for you, and then any other parting thoughts you want to give us. So Congresswoman Underwood.
I think that there's an increasing role for corporate America to be at the table. We have some incredible partners for companies that are consumer brands that many of us use, Uber, Lyft, Pampers, Huggies, but then outside of that space, we're not and then obviously the health insurance companies, Walgreens, CVS, whatever, but we're not seeing the kind of, thank you, Aetna. Thank you, Aetna. I wasn't trying to be dismissive, sir. Thank you so much for your partnership and leadership in this space. Okay. Ma'am, I'm sorry, Mayor. We need more corporate leadership because these companies have the data. And oftentimes, these companies have the data before they are reported to federal sources. We are trying to clean up the federal reporting from every state, but guess what? Yesterday in the news, y'all can look it up in the Houston Chronicle, we got crazy mayors like Greg Abbott trying to suppress the information about maternal death till what? After the election. Right, they're doing stuff like restricting people's reproductive rights and moms are dying as a result of childbirth. But guess what? The companies have the information. And if we have the information, going back to my assessment point, right, we can better solve these problems. And so I would invite these corporate stakeholders, people who are active in this space. You know, we got a lot of apps on our phone. We are sharing our data with a lot of companies, and they know when we are having emergencies. They know when we're having adverse pregnancy outcomes. They know when there's complications, right? All of those players need to take some ownership and joining us to save moms' lives. And all of you, I would welcome you to join us to the Black Maternal Health Caucus. You can find us on Twitter at BMH Caucus. Together, we're going to get the Momnibus signed into law. We're going to get some money into these communities. And before I go, I just have to say, there's a lot of conversation about the District of Columbia and the disparities in this community. But there are some bright spots of innovation and clinical excellence happening here in the district that is a shining role model for communities across the country under the leadership of your mayor. And so I just want to acknowledge the great progress that has been made and the work that has been done, and what we are trying to do is give y'all the resources to take it nationwide.
Yes. Thank you. Thank you, Congresswoman. First, let me just say DC is hiring, dchr.dc.gov. So we are hiring. And I am very proud. One of the bright spots we have here is a locally funded paid family leave program that provides tremendous benefits. And you will hear me say often, while I'm proud of our program, I don't think DC residents and businesses should be the only ones paying for it. So you ask what's missing. We need a national paid family leave law.
Hear, hear.
That's right.
Because we need people to be able to take the time that they need before birth, for birth, after birth, without worrying about how they're going to pay the rent. So that would be, I think, one big thing that we can do nationally that would really change the environment for people giving birth.
Thank you, Mayor. You all heard it. I know you all took copious notes, okay? We are expecting that folks will leave this summit and be change makers. That's what we're expecting. And not just for the folks in this room, we are expecting you all to go out and tell another one and another one and another one. That's how we build collaboration. That's how we build change. And I see somebody putting her hand up. I hope that means yes, like you do at church, like yes, that's what we're gonna do. So with that, I'm going to thank our amazing panelists. This has been an amazing conversation. Thank you for kickstarting today's summit. And I hope that the rest of the summit is equally amazing. And everyone, as my former mentor, the late great Congressman John Lewis always says, go out and get into good trouble. So I leave you with that. Take care.